So echocardiographic window plays important role in assessing cardiac functions and their abnormalities. Good morning all, this is Kavipriyabalu, lecturer from Department of Cardiac Technology. Now the class is about echocardiographic windows. There are three more types of windows are there. One is parasternal long axis window, parasternal short axis window, apical window, suprasternal window, subcostal window, and there including windows are some modified windows also will be there to visualize or magnify what are the importance we have to know can be magnified. And here a parasternal long axis window is about, it is very useful to assess the LV functions and posterior wall function, mitral valve area, aortic valve area and mitral valve disease at all. And parasternal LV function mainly, and parasternal short axis windows are aortic valve short axis, mitral valve short axis, LV level, there are basal, mid and apical, including that mitral valve short axis are there, which is majorly helpful for us to understand the LV functions and valve area marking at all. Majorly aortic valve and mitral valve short axis are important for valve area marking. Okay, mitral valve short axis will help us to understand the planimetric tuticus opening of mitral valve, which is important method to assess mitral valve stenosis. Likewise, aortic valve short axis also. It is also important, more important to assess aortic valve area, which is whether it is opening or not, and any chambers are get dilated. If it is there in LA appendage clot, we are also helpful to which views are more helpful to assess the clot and RV outflow tract area and pulmonary arteries at all. And next one is apical window, which is 4 chamber, 2 chamber, 3 chamber and 5 chamber window, which is also help us to read about LV systolic function, LV diastolic functions, filling pressures at all. And RV side also we can able to study about study in this video in apical 4C, 5C, 3C at all. Next views is about subcostal window. Subcostal in sense which is helpful for us to understand the pericardial studies, shunt calculation, any clot or vegetation, mass at all. And majorly it is useful to diagnose IVC, inferior vena cava, okay, and segmental approaches also. Then suprasternal window, which means a superior to the sternum, suprasternal window, which is also help us to find out the PDA, congenital heart disease, aortic valve disease, that is aortic dissection or aortic valve coarctation, aneurysmal aortic valve disease at all. Now see, our student will explain how these are the valve views or help us to find out the a cardiogram abnormalities and normal functions in our heart.
I am Aishwarya from the Department of BSc Cardiac Technology. So today we are talking about left parasternal long axis. Okay, let's talk about the left parasternal long axis views or simply PLX. So when we do an echo, we need some standard views to understand how the heart looks and works. One of the first and most important views we take is the left parasternal view, and from that the most common one is the PLX view. Basically, the left parasternal long axis views is taken by keeping the probe on the left side of the chest and near the sternum. Usually in the third or fourth intercostal space, the probe maker is pointed towards the right shoulder. The position gives us the longwise view of the heart.
So we can discuss detail about the left parasternal axis view, where it is located in the left sternum and the 3 to 4 intercostal space. Parasternal long axis view, by using 2D, we can measure the LV cavity, LV thickness, access LV radial function, LV appearance and the LVOT appearance, structure and mobility of AV, LMV. Then we can see pericardium and right atrium, left ventricle, left atrium, inspect proximal ascending and descending aorta. In parasternal long axis view, we can use M mode by obtaining C, aortic root, LA diameter, LV thickness. Then by using color-wide Doppler, we can see AV stenosis, regurgitation of MV, check for the flow and acceleration. In LVOT, in association with septal hypertrophy, integrity of IVS. So now we are getting to the parasternal right ventricular inflow view. Tilting the probe to that in point more medially and